At this time, I'd like to introduce Dr. Sam Naficy, Clinical Assistant Professor from Otolaryngology, Head and Neck Surgery, for his discussion on facial rejuvenation.
Thank you, Dr. Wilson and Dr. Sayers, for asking me to speak today, and I'd like to thank Dr. Mostafapour for his thorough evaluation of the case. I'd like to continue the discussion today about facial rejuvenation. I'll be discussing some techniques of rejuvenating the lower face and the neck as well as the eyebrows using a combination of surgical techniques and laser resurfacing. I will also be discussing some procedures which are performed on the non-aging face. The goal of any facial plastic surgery procedure should be a procedure which is safe, produces a natural outcome, and restores the lost facial harmony. When I look at facial plastic surgery, I divide it into two broad categories. Those categories being non-aging face and aging face. The non-aging face categories are ones in which the deformity or the area that's being corrected is really not an age-related issue. For example, rhinopalsty or ear reshaping or chin or cheek augmentation or lip augmentation. In contrast to aging face procedures whereby we are restoring features that have been altered due to the aging process. When I look at facial aging, I look at two different processes that happen side by side. One is the change in the facial skin. The other is a change in the soft tissue underlying that skin, the fat and the muscle, as well as the bone. So what are some of the changes that we see in the facial soft tissue with aging? This slide summarizes a lot of those changes. As the forehead and the entire brow region droops and elongates, we see ptosis, drooping of the eyebrow. As the person is attempting to keep that droopy eyebrow up, we see horizontal wrinkles across the forehead. As Dr. Sayers and Dr. Ahmadi mentioned, there's protrusion, prolapse of the fat pads surrounding the eyelid. In some individuals, we see prolapse of the fat across the entire eyelid sulcus. In some individuals, we see the reverse. We actually see hollowing of the eye. Certainly laxity and lowering of the lower lid margin is seen, and along with that, prolapse of the lower eyelid fat and dermatochalesis. As the lower eyelid fat prolapses and as the cheek fat settles and atrophies, we see a very well-defined malar crescent. Again, as the fat pad atrophies and descends, we see prominence of the melolabial fold. There's certainly perioral wrinkling and a thinning and atrophy of the lips. The corner of the mouth droops. There is jowling, and that's outlined by the labiomandibular groove. And as the neck muscle, the platysma, weakens and relaxes, we see platysmal bands and neck laxity. So it's important to analyze the patient for any or all of these features because the treatment for them is not necessarily the same. You probably all noted from the previous picture that there was loss of facial volume with aging. I think that's an important principle that we've ignored for a long time. We always think of aging as too much skin, but when you look at this patient, you certainly know that as we age, there is certainly loss of facial volume, bone, muscle, and fat. So the skin could even stay the same in terms of the surface area and would still have relative excess of skin. Although the skin actually does seem to lose some of its elasticity with aging. And I'll be talking about that next. What are some of the changes that we see with facial skin? Well, this is what young skin looks like. We have the upper layer, which is the epidermis. We have a zone below it called the Gren zone. The Gren zone is the zone of collagen production. That's the uppermost layer of the dermis where the fibroblasts, the cells that make collagen, are constantly producing new layers of collagen. But with young skin, the collagen underlying that zone looks relatively uniform, regular, and undamaged by the sun. As opposed to something like this, with someone who has signs of significant sun damage, their skin, as stained in this case here, shows the multiple irregularly tangled fibers of the damaged collagen. You can see that the collagen has lost its regular alignment. But you do still see that zone immediately underlying the epidermis where there is still active collagen production. So the way we think of the biology of a wrinkle is that normally the collagen fibers can glide over one another, giving skin its softness and resilience. But with continued sun damage and the free radicals forming cross-linking of these collagen fibers, the skin tends to lose that resilience. And really, this microscarring at a molecular level is felt to be the cause of a wrinkle. So what are the causes of free radicals? Well, age. Basically, our body is a machine. We're constantly metabolizing fuel, and a byproduct of that is free radicals. Certainly, there is an involvement of heredity. Some of us may not have the repair capacity that others may do in terms of dealing with these free radicals. There's no question that sun exposure and smoking play a part, and there is some new investigation into certain dietary supplements, which a lack of these supplements may also advance cutaneous aging. So I'd like to talk to you a little bit about principle of laser resurfacing. Dr. Berg from Department of Dermatological Surgery will be talking about principles of laser physics, so I won't go into detail of that. But I do want to tell you that the principle of laser resurfacing is using the laser to ablate, to peel away the top layer of the skin, and that includes the entire epidermis and a variable degree of the dermis. That process will stimulate growth of a new collagen layer to replace the older and sun-damaged collagen layer. And the histology of that is illustrated in this slide, where you see the epidermis, you see the Gren zone, and you see this newly generated zone of dermal collagen, which has literally pushed down the older sun-damaged collagen. And what does that translate to in a clinical case? Well, this is basically the improvement that you see after laser resurfacing. And surgery will not give you the improvement that you've seen in this patient's mouth. That's purely a change at the level of the skin. I'd like to next move into facial cosmetic surgery procedures. And I'm going to start with talking about face and neck lifting. Facelifts are also known as rhinopalsty or rhinopalsty. This procedure is usually performed on women in their 4th, 5th, or 6th decade of life. A facelift in reality is a face and a neck lift, as it truly does rejuvenate the neck as well. It can reduce the effects of gravity on the lower face and neck, that is jowling, cervical laxity, loose skin of the neck, cervical lipodystrophy, that's excess fatty deposits within the neck, and platysmal banding. Those are the bands that we see in the midline of the neck. Combining facelifting with laser resurfacing allows us to get very drastic improvements by simultaneously addressing the aging of both the soft tissue and the skin. For patients, the recovery time after facelift surgery is usually no more than 2 weeks. What I consider a good candidate for facelift surgery is somebody who's emotionally stable. Dr. Sayers alluded to that. The motivation for surgery is very important. Patient should be physically healthy, should be a non-smoker. Patients who have slightly thin face with good bone structure tend to get better results, and also good hair density so that during the healing period they can camouflage the incisions. And obviously the reverse of that would make a patient a poor candidate. In terms of facelift anatomy, the probably 2 most important things to remember are the structures that I have outlined on the left, the SMAS and the platysma. The SMAS is an acronym for the superficial musculoaponeurotic system. This is a fibrous continuation of the platysma in the face. The platysma, as we all know, is a very thin sheet-like muscle that starts in the lower face, and it can stretch all the way down into the neck onto the collarbone. The SMAS is the continuation of that structure in the face, and it's critical to tighten that structure during a facelift procedure. And the platysma as well is also tightened during a face and neck lift procedure. What is constant with all facelift procedures is step one, placing the incisions. These are hidden in the temple, around the ears, and in the occipital region. A variable degree of undermining of that skin, lifting of that skin, and then redraping of that skin, removal of the excess skin, and then repair of the incisions. There are different techniques in terms of undermining and the depth at which that undermining is performed. The most simple technique is just a subcutaneous undermining. That is, the skin is only lifted up and it's pulled back and redraped and the excess is trimmed. That certainly does not give us the long-term result and also the natural result that, that we would like to achieve, although it's one of the earlier techniques of facelifting. In addition to subcutaneous facelifting, something can be done to the SMAS. It can be tightened, a separate flap of the SMAS can be elevated, or a strip of the SMAS may be removed and the two ends sutured together. And that certainly addresses the laxity at a deeper level, at the level of the facial muscle. The SMAS could be lifted as a composite flap in conjunction with the skin, so the two structures are lifted together. And that's the technique that I use most often, along with the deep plane facelifting, where not only the SMAS, but also the malar fat pad is also removed. You'll notice that the facial muscles, the orbicularis oculi and the zygomaticus major and minor, are left down. They're not lifted with this flap. And the reason for that is that the facial nerve supplies these muscles from the underside. So as long as those muscles are preserved and kept down, there is no risk of injury to the facial nerve. Something is done centrally to the neck in terms of improving the neck bands and the excess fat of the neck. And also, chin augmentation can be performed through that incision. This is a typical case of a woman who presents for improvement of her neckline. She had had a liposuction years ago, and I did a subsmass face and a neck lift on her. This is a woman who presented for complete facial rejuvenation. As you can see, she has some fat prolapse and some dermatochalesis of her lower lid. I performed four-lid blepharoplasty and a face and neck lift on her. And performing this procedure at a deeper plane really addresses the jowling. It gives a much straighter jawline and also a much more natural result. This is her profile view. Again, somebody with a deep plane face and neck lift, addressing the laxity of the neck and jowls. This woman was in her 50s, as was the two patients prior to that. Now, combining surgery with laser allows us to address the effects of both soft tissue and the aging of the skin. The aging of the skin by itself would not be improved with facelifting. This is a woman in her 50s who illustrates significant sun damage. She also has a moderate degree of jowling and slight degree of neck laxity. So for her, a combination of facelifting and full face laser resurfacing using the CO2 laser allowed me to get a result that is more comprehensive and more natural than doing just a facelift procedure. A patient who demonstrates, excessive fat deposits of the neck, a retruded chin, some jowling, as well as some wrinkling of the lower eyelids and crow's feet, and excess skin and fat of the upper eyelids. She underwent four-lid blepharoplasty. Actually, she underwent upper lid blepharoplasty with laser resurfacing alone for her lower lids and crow's feet, and neck liposuction, face and neck lift, and chin augmentation. And again, doing a composite approach, treating all areas which need correction allows you to get a more comprehensive result. This is the case that Dr. Mustafapour presented, and as he alluded to, the patient does indeed have a long forehead with a moderate degree of eyebrow ptosis, severe photoaging of her skin, particularly of the mouth and the eyelid and the crow's feet, severe jowling and neck laxity, and an underdeveloped chin. So my plan was to perform a hairline brow lift, augmentation of the chin, face and neck lift, and CO2 laser resurfacing of her eyes and mouth. And this is the result that can be achieved using a combination of all those techniques. One technique alone will not allow you to get a comprehensive improvement like that. And again, without the use of lasers and without the use of augmentation of her chin, there was no way that I could have addressed her aging mouth to the extent that I was able to. And again, a close-up of what the laser can do around the mouth. Surgery and laser resurfacing can be combined with to do a comprehensive orbital rejuvenation, as Dr. Sires alluded to. This is a patient who's had prior upper and lower blepharoplasty who presented to me for really very severe excess skin and muscular redundancy of her lower eyelids. As you can see, she has some residual fat pad of the upper lids in the medial compartment, which was not addressed. She had excessive skin, a redundancy of her lower lids. She had very poor lid tone, and there was also some excessive lateral fatty deposits on the right side. So again, my plan was something more comprehensive, a hairline brow lift, revision blepharoplasty to excise the residual fat in the medial compartments. I did not excise any skin from her upper or lower eyelid. I did excise some fat from the lateral compartment of the lower eyelid, and I performed a bilateral tarsal strip lid shortening procedure in an attempt to stabilize the lower lid margin so that I could do a very aggressive resurfacing. If I were to resurface her lower eyelids without tightening it, she for sure would have had lower lid retraction. I'm going to walk you through her recovery period. This is what she looks like at 10 days. By that time, the skin has healed from the standpoint of the epithelium. The epithelium has been replaced. It's still red and shiny and pink, but the skin is no longer raw. And at 1 month, the redness is improving, the swelling is improving, and her lid margin is holding up relatively well with the tightening. And this is her 6-month follow-up. So by this time, the edema and the redness has settled down significantly. And this is a close-up of her view. Again, without the use of laser, I don't think I could have achieved the improvement of her lower eyelid skin. I'll just talk for 2 minutes about additional procedures for the non-aging face. Lip augmentation is a commonly requested procedure. This balances the upper and lower lips. It can enhance the patient's profile. It actually makes, in some instances, it can make the nose look smaller by just bringing the upper lip forward. And in this particular patient, this was performed using collagen, which usually lasts about 2 to 3 months. This other patient had upper and lower lip augmentation using Alloderm, which is a longer-term product, and will usually give a long-lasting augmentation. Just show you a few patients who undergo rhinoplasty. With rhinoplasty surgery, very much like oculoplastic surgery, as Dr. Sires mentioned, the key now is conservation, is about preserving structure and doing more subtle modifications to improve the contour. So I tend to do very small number of procedures where I do significant reduction of tissue, and I'll show you some examples. Again, here's somebody who just didn't like the hook on her nose, the dorsal hump, just a very subtle a reduction, subtle increasing of the angle of the tip, and she looks like she has a natural nose that does not look like it's been operated on. Another patient who has a hanging nostril, slight fullness of her tip, and again, just doing something very subtle can produce a pleasing change. A young man, again, with a hump on the bridge of his nose and a slightly droopy tip. Again, just making some subtle changes in the tip, slight bit of reduction of the nasal dorsum. And in his case, I actually added some cartilage up top to the region of the eyebrows, and that brought his nose into balance. This concludes my talk. I'd like to thank you for this opportunity.